my name is Juliana Regan and I'm a registered nurse at MGH Allergy Associates. Today I'm going to teach you how to use your nasal spray, saline sinus rinses, and inhalers. First, I'm going to show you how to use your nasal spray. Start by gently blowing your nose to clear it of mucus before using the medication. The first time you use your nasal spray, you may have to prime it by squirting a few times into the air until a fine mist comes out. Start by removing the cap, shake the bottle, and tilt your head forward slightly. Insert the bottle tip into your nostril. Use the other hand to close the opposite nostril. Squeeze the pump as you begin to breathe in slowly through your nose. Repeat these steps for the other nostril. If you're using more than one spray in each nostril, follow all these steps again. Try not to sneeze or blow your nose just after using the spray. Spray away from the septum or away from the center of your nose to avoid irritation. If the spray is used correctly, the spray should not drip from your nose or down the back of your throat. If your nose hurts, if you begin to have nosebleeds, or if the inside of your nose stings, stop using the spray for 1 to 2 days. Sometimes it helps to use a saline nose spray just before you use your regular medication. How to perform a saline sinus rinse. We recommend purchasing the NeilMed sinus rinse bottles carried by most pharmacies. You want to start out by filling your bottle with 8 ounces of saline rinse solution. Stand bending over a sink or get into a shower. Put your head in a neutral position, looking straight ahead. Do not tilt your head backwards. Place the bottle nasal tip inside nose and tip pointed straight back. Do not point towards the center of the nose or septum, as the septum is easily irritated. Gently squeeze the bottle so that the bottle flows up through the nose and into the sinus cavity, and it comes back out the opposite side of the nose. Continue squeezing your bottle until approximately half or 4 ounces of bottle have been expelled. Repeat on the other side. Disassemble your nasal irrigation bottle and clean it in water and dish detergent. Rinse and air dry. For a saline solution formula, recipes can be obtained in their clinic, or you can buy pre-mixed packages over the counter. So next I will be teaching you about how to use your inhalers. There are 2 types of inhalers. First, there are relievers or rescue inhalers, also known as bronchodilators. These inhalers are used as needed and work quickly for symptoms such as wheezing, coughing, and shortness of breath. Another type of inhaler are controllers or anti-inflammatories. These inhalers reduce and prevent excessive mucus and swelling in the airways. They do not work immediately and need to be used regularly to be effective. Effectiveness of these medications is fully dependent on your ability to inhale them properly into the airways. Many devices have online videos that you can watch to find out more about them. Always refer to the instructions for use packet with questions prior to using your inhaler to find out about priming techniques for first use and other instructions we may not have reviewed today. Keep track of the amount of medication left in your inhaler by checking the counters or reading instructions on how to keep track with your specific inhaler. Review cleaning instructions in the instruction for use packet as well. Next, I will show you how to use your metered dose inhaler. Start by removing the cap. Shake your device before each spray. Exhale all the way away from the device. As you start breathing in slowly through your mouth, press down on the inhaler 1 time. Keep breathing in as slowly and deeply as you can. Hold your breath for 10 seconds. For inhaled quick relief bronchodilators, wait about 60 seconds between puffs. There is no need to wait in between puffs for other medications. Next, I will show you how to use your spacer. For many people, using a spacer or a valved holding chamber for your metered dose inhaler will help increase the amount of medicine that is getting into your lungs. Start by taking the cap off of your spacer and your inhaler, and then shake your inhaler for the recommended amount of time, 10 seconds for example, and insert the inhaler into the back of the valved holding chamber. Exhale, then place your mouth on the mouthpiece of the spacer. Press down on the inhaler, breathe in slowly through your mouth as slowly and deeply as you can. Take the spacer out of your mouth and hold the medication in your lungs for 10 seconds. Exhale. Use an additional puff if indicated, waiting a minute in between use to allow your lungs time to expand after the first puff of the medication. If you hear the spacer whistle, you're breathing in too quickly. Spacers should be rinsed once a week and can be left to air dry. Next, I will show you how to use your advair discus. The advair discus is a dry powder inhaler that uses the normal force of your breath to draw in medicine stored in a chamber that you load immediately prior to use. Here's how to use your discus. While holding the discus in one hand, place the thumb of your other hand on the grip and push away until the mouthpiece appears and snaps into position. Hold the discus level and slide the lever away from you as far as it will go until it clicks. Breathe out all the way, then place your lips on the mouthpiece. Breathe in steadily and deeply through the discus. Hold your breath as you count to 10 slowly if you can. Then close your discus. Rinse your mouth with water after each use. I hope this information has been useful. If you have any questions about your medications or how to use them, please reach out to your allergist or your primary care physician. Thank you.